Hey, hello everyone. So now we are going to discuss about metabolic and endocrine pathologies. So we are going to discuss about scurvy, rickets, then we will discuss about acromegaly or gigantism. Then we will discuss about fluorosis, which is more commonly seen in this district of Nalgonda, just in our periphery of AIIMS Bibinagar. Then we will discuss about uh, different skull appearances in these pathologies. So first one is scurvy. Look over here. Here we can see that this is which joint? Yes, this is the knee joint. And here we can see that there is a subperiosteal hemorrhage, right? So look over here. Here we have the subperiosteal hemorrhage, and just below it on this joint, here we can see that there is dense zone of provisional calcification, which is called as white line of Frankel. This is called as white line of Frankel. And just look over here. Here we have the ring epiphysis, which is called as Wimberger's sign. So don't confuse here with Wimberger's sign and Wimberger's corner sign. So Wimberger's corner sign, which is seen in congenital syphilis, while Wimberger's sign, that is ring appearance of epiphysis, is seen in scurvy. Then look over here. This is called as the Pelton spur. Okay, so these are the extensions observed at the metaphysis. And look over here, just adjacent to the Pelton spur, here we have the scorbatic zone, which is also called as Trummerfeld's zone. Okay, so these are the some important features of scurvy. But do you know why scurvy occurs? Yes, it is because of vitamin C deficiency, right? So yeah, this is about scurvy. So we just discussed about vitamin C deficiency. Now let's look over vitamin D deficiency, or it is also called by the genetic causes. So it is rickets, right? So rickets is a condition that results in weak or soft bone in the children. And we know that symptoms include bowed leg, stunted growth, bone pain, large forehead. So these are the clinical things to look. But what are the radiological features? So look over here. So we previously discussed that in scurvy there is a white line of Frankel, but here there is no white line of Frankel. However, the line is observed after the treatment is given. Okay, so we can say that the white line of Frankel present in healing rickets. Now look over here. Here we have widening, or we can say splaying of bones present. Okay, now look over here. Here we can see that here we have the irregular margins. So these irregular margins, it's called as fraying. So cupping, fraying and splaying seen in the rickets. Okay, so this is about the rickets. Now let's talk about gigantism, or we can say acromegaly. So what happens in acromegaly? It is because of excessive growth hormone production in skeletally mature patients, most commonly from pituitary adenoma. So we know that there are different clinical presentation patient can present with. So there might be muscle pain, joint pain, arthritis. There can be carpal tunnel syndrome, obstructive sleep apnea. In severe, there might be cardiomegaly, hypertension, heart failure. But what are the radiological findings can be seen in this image? So look over here. Here we can see that the terminal phalangeal tufts become hypertrophied and have spade appearance. Okay, so look over here. We called it as spade phalanx, right? Then look over this heel pad thickness. So the heel pad should be normally less than 25 mm, but here it is more than 25 mm. So it is the heel pad sign. And we know that in acromegaly there is frontal bossing. So these are the radiological findings can be seen in gigantism or acromegaly. Now let's talk about the fluorosis. So we know that the periphery of this AIIMS, or we can say the Nalgonda district, or we can say that this is the fluorosis belt in Telangana. So here we can see that there is diffuse otosclerosis present, and here we can see that ossification and calcification in the ligaments and interosseous membrane. So look over here. Here we have the sclerosis of interosseous membrane, and there also ossification of interosseous membrane between radius and ulna. So there is sclerosis and there is ossification. And And in fluorosis, there might be sacrotuberous ligament ossification. So look over here. Here we have the sacrotuberous ligament ossification, right? Now let's talk about some important findings in skull X-ray in these metabolic and endocrine pathologies. So look over here. Here we can see that there is a salt and pepper appearance of the skull, and yes, it is seen in hyperparathyroidism. Okay. Now look over here. Here we have the lytic lesion of the skull, or we can also say that this is the geographic lesion. So yes, this is seen in Langerhans cell histiocytosis. Now look over here. Here we have the multiple punched out lytic lesions of the skull, or it is also called as raindrop lesions. So these lesions are, look over here, these are well defined lytic lesions without beveled margins, right? And most of the same size. So this called as punched out lytic lesion, and this is seen in multiple myeloma. Yeah, and involve both tables of the skull equally. Now look over here. Here we have the hair on end appearance, or it can be also called as crew cut appearance. So it is generally seen in hemolytic anemias. So hemolysis causes compensatory increase in hematopoiesis. So there is diploic widening of the skull with formation of prominent trabeculi. Okay, so it is seen in hemolytic anemias. Example are sickle cell anemia, thalassemia, or G6PD deficiency. Okay, so this is about metabolic and endocrine pathologies. So first we learn about scurvy, and there we know that the white line of Frankel, Trummerfeld zone, yeah, Pelkan spur, Wimberger's ring signs. Okay, so this sign seen in scurvy, while in rickets there is fraying, cupping, and splaying of the bone. Then in acromegaly we saw three signs: spade phalanx, hill pad thickness, and frontal bossing. And in fluorosis there is ossification of intraosseous membrane, and also sclerosis in the ligament and intraosseous membrane. Okay, and then we talk about skull appearances, where salt pepper appearance, beveled lytic lesions, and also about punched out lytic lesions and hair on in appearance. So this is all about metabolic and endocrine pathologies.